Now to learn more about the breakthrough, we're joined now by Dr. Michael White, a dermatologist with the Mayo Clinic Health System. Let's start with skin cancer, the most common form of cancer. Is it really just caused by exposure to the sun?
Basal cell and squamous cell skin cancer are caused by sunlight. Those are the most common of all the skin cancers. Melanoma is the least common but the most deadly. There's an interesting study from Iceland which never had melanoma, and recently they've seen a dramatic rise in melanoma about 5 years after a rise in tanning beds.
Interesting.
So ultraviolet A, which is in tanning beds, is part of sunlight, seems to contribute to making the worst kind of skin cancer, melanoma. There's no such thing as a safe tanning bed.
Let's turn to the pill now. Is this a huge breakthrough?
This is a major breakthrough. I cut skin cancers off every week. Melanoma, if we catch it when it's small in the skin, we can cure it completely. Once it starts to spread to other sites, our usual treatments do not work very well. There are a few patients that are helped by experimental medicines, by immunotherapy, by treatment courses that take weeks or months, and they don't help everybody. What's new is they found there was a mutation in a particular pathway, and it's all alphabet soup. Just remember BRAF, like they talked about in the national news. Little more than 50% of patients have this mutation in the tumor. Doesn't mean the patient has it. That's a mutation that the tumor acquired. Now we have a group of drugs that specifically tolerate that mutation, that pathway, and there's a dramatic response. In hours, in days, there are patients...
The lady in the story was less than a week.
Right. It melts away. Now, I need to caution people that this is early, that this is still experimental data, that the remissions are temporary, but there's some early research using combinations of these drugs that shows even more promise.
And again, we're talking about people that were at a point where they thought there was no hope.
Exactly.
This new experimental medication and...
First of all, it's a pill. It's not shots. It's not weeks and weeks of painful medicines. There are relatively side effects, relatively few, and this is very promising data. It's still research. It's not generally available, but you can bet Mayo Clinic and our system will have it available as soon as possible.
We've got about 30 seconds here. Last question. I know that you said that it's real early on. Any chance that the skin cancer adapts and can kind of beat the pill?
That's one of the things they've seen in a few cases where the tumor comes back. It somehow beat the pill. That's why there's some hope for hitting this pathway in more than one place. There's early data to suggest that's the case, but it's all research, and I haven't seen all the data myself yet. This is brand new.
Dr. Michael White, exciting time in the fight against skin cancer. We
Very
appreciate
much.
you joining us.
Thank you for having me.